Okay, thank you everyone joining us online and in the room. Thank you everyone for your introductions. I just want to start off, this is Blair Budd, by saying thank you so much to our venue, ASM. We're lucky to have a few members in the room that just introduced themselves. Thank you for supporting us and allowing us to meet here and every month. We appreciate you guys, as well as for everyone enjoying us on their couch or in your PJs. The One Health Commission sponsors us for the webinar. So not only do they allow you this access, but they let us have access to the recordings afterwards. So we appreciate them and encourage you to support both groups. So thank you for joining us tonight. Without further ado, I'll get started with our introduction to our speaker this evening. Tonight, we are fortunate enough to have Dr. Scot Hagerthey join us with presenting on Report on the Environment and One Health, Trends Reporting in the 21st Century. Dr. Scot Hagerthey is a Senior Science Advisor for Ecology in the EPA's Office of Research and Development, Center for Public Health and Environmental Assessment. His career focus is the strategic development, implementation, management, and communication of policy and regulatory relevant ecological programs to protect, manage, and restore environmental resources. In his current leadership role, he works to provide the scientific foundations for EPA strategic, regulatory, and policy decisions. This is achieved by delivering high-caliber scientific services and expertise that support high-profile, often controversial, ecological and human health assessments, and developing innovative assessment methods, tools, and techniques to solve complex problems. His scientific life work has spanned the study of the Great Lakes, Europe's mudflats, and the Everglades. Scot earned his PhD in biology from Michigan Technological University and a bachelor's degree in biology from East Carolina University. Please join me in welcoming tonight Dr. Scot Hagerthey.
I think someone needs to work on my sketch there. It's a little wordy. Thank you very much for hosting me tonight, and I really do look forward to talking to you today about the Report on the Environment, one of EPA's projects that I've had the pleasure to lead for the last 4 years. The controversial part in that little bio sketch, I think, is an interesting component because I come from a part of the Office of Research and Development at EPA that does the human health and environmental assessments. We're all based here in DC, North Carolina, and Cincinnati, but we do all the big high-profile stuff to synthesize the science that feeds into policy. Some of the things you might know about us is that we have the IRIS program, which is always on the Hill. That's the Integrated Risk Information System that provides the hazard characteristics around a lot of the chemicals. We do the Integrated Science Assessment, which is the scientific foundation to support the National Ambient Air Quality Standards for the Office of Air every 5 years. The part that I've led is actually on the environmental side, where we've done the Bristol Bay, the effects of the Pebble gold mine on Bristol Bay, the Alaskan fishery. We did the effects of hydraulic fracturing on drinking water. We did the waters of the U.S. Connectivity Report. So we tend to grab onto the science that's really the controversial bit. But one of the products that we have is the Report on the Environment. And so I thought I would start this talk and trying to think about the linkage between One Health and the Report on the Environment, and what does it mean? What do I want you to kind of take away from this lecture and this talk? Because the Report on the Environment doesn't have that many linkages directly to One Health, what I thought I would do is actually walk through and talk about indicator platforms and indicator resources, and then end with some information from the Report on the Environment that maybe you'll find interesting. So the take home here is for you guys to come back and when you're looking at indicators and you're looking at indicator platforms, what is the type of information that I should be gleaning from them, and what are the questions I should be asking in order for me to make an informed decision about that trend or that analysis? And so I started here with the actual mission statement for the One Health initiative, and highlighted here in red, the part that I really like is your vision statement, which is One Health, formerly called One Medicine, is dedicated to improving the lives of all species, human and animal, through the integration of human medicine, veterinary medicine, and environmental science. And I think that linkage is really fun and really cool. The One Health shall achieve this through 7 points. And what I want to point out are those areas that are highlighted in red, which is communication, joint efforts in clinical care through the assessment, joint cross-species disease surveillance, and then the last one, the joint efforts to inform and educate political leaders and the public sector through accurate media publications. All of this is about producing information that is accurate, reliable, and being able to synthesize it in some way that somebody can use. So how do you get there? How do you recognize it? And so the goals for this presentation is for me to kind of share my experiences as having worked on the report on the environment to achieve your goal of joint efforts to inform, educate political leaders in the public sector through accurate media publications, and then all those other red words up there as well. I'm going to try to do this through 3 ways. One, I'm going to introduce you to what drives the indicators that you're looking at the platform of the questions. And so what drives status and trends reporting for human health and environmental condition? And from the report on the environment's perspective, there's 2 things. There's statutes and mandates, and there's strategic directives. And then I'm going to go into a little bit about what makes an indicator effective and why that's important. There's a lot of data out there. So how do you know what you're looking at is something that I can rely on and get to that point. And then I'm going to walk through what the report on the environment is. It's an ever-growing, ever-changing, ever-evolving platform. And so there's connections between One Health, the Academy One Health Initiative, the One Health Framework, or anybody else. We can actually try to have discussions to bring them into the report on the environment. So we'll talk about that a little bit. You're going to see this probably 3 or 4 times today, our vision statement, not so much our mission and goals and client statement, but the report on the environment is our vision statement is that the U.S. Environmental Protection Agency's report on the environment is nationally and internationally recognized as a flagship product that provides environmental policy decision makers and others with scientifically defensible, objective, relevant information of national importance on human health and the environmental status trends and assessment. In our mission statement, we actually work on the ability to analyze, diagnose, and communicate the reasons for and relationships between trends and stressors and environmental and health outcomes and the effectiveness of these actions. Our goal is to continually promote the use and improve the impacts of the report on the environment as an effective decision support system, continually strive to innovate and create approaches that improve the influence and impact the report on the environment has on making and communicating environmental decisions. And one of the things that I think is most critical when you're looking at indicator platforms or you're looking at indicators is to know who that indicator was designed for. Who's the client that that indicator is being used for? And so this is really important because at the EPA, we made the determination that our primary client are the decision policymakers within the US EPA, the administrator and assistant administrators of programs and regional offices, and our partners in the executive and legislative branches of the US government. We also serve the interests of states and tribal entities, academia, the business community, non-governmental organizations, and the general public. And so when we think about indicators on the report on the environment, we think first and foremost the agency. That's our primary client. And so that frames what we put on there, what indicators we choose to present on the report on the environment, and what indicators, essentially just what indicators we put on the report on the environment. So what drives status and trends reporting for human health and environmental condition? Within the US government, the primary driver for us is the environmental statutes that Congress puts together. These will influence the who, what, and how data are collected and reported. Within the US, we do not have a single entity responsible for developing, collecting, and reporting human health and environmental status and trends. Surprising as that may be, we don't have a single platform. I'll show you in a few slides that we have a whole bunch of platforms that all do very specific things, but there's not one that draws them all together into one place at one time. And this is primarily due because of the mandates that are the statutes that are put forward by Congress actually will dictate the responsibilities as to who that information is supposed to be, is responsible for that information. So for example, the Environmental Protection Agency, the National Oceanographic and Atmospheric Administration, the Center for Disease Control, the Food and Drug Administration, and many others will be mandated by statute to collect and report certain information. At the EPA, we're influenced by many different major, many statutes, some minor, some major. These are the major ones. So we have the National Environmental Policy Act, NEPA, Clean Air Act, Clean Water Act, Safe Water Drinking Act, Resource Recovery, Conservation and Recovery Act, Pollution Prevention Act, so forth, so on down the line. And in each one of these statutes is usually an edict or a mandate to actually collect and report the information that's associated with that law. Now, the key thing is that each one of those laws spells it out differently as to how it can be done. And I'll show you an example that's relevant within the report on the environment between air, how you report trends in air, and how you report trends in water at the national scale in the United States. And that all has to do with language as it was written in the Clean Air Act versus the Clean Water Act. Because of these different statutes and the way that everything's divvied out and who has responsibility, there's lots of different platforms that one can go to get a lot of different information on trends and status. At EPA, you can go to the US EPA Air Now site, which is out of the Office of Air, the American Children and the Environment site, which is out of the Office of Children's Protection. Climate Indicators is out of the Office of Air. EnviroAtlas is out of the Office of Research and Development. The U.S. National Aquatic Survey is out of the Office of Water. Safe Drinking Water Information System is out of the Office of Water, and Sector Snapshot is Office of Policy. Each one of these has a different level of scale that they can report to. Some are national in scope, some are community in scope, some are state in scope, some are regional in scope. So each one of these is different. And it's usually driven by the mandate, the statutory mandate that requires them to report it in such a way. Beyond EPA, you then get into other platforms like the Environmental Council of States, ECOS, which reports state trends. And that's a bunch of the states in the US getting together to say that we want to report out information on a variety of different themes. The CDC is probably what this group is most familiar with in terms of the products that they produce in terms of assessing stuff. NOAA is probably one of the leaders in how you do this in terms of the technology and the resources that they bring to bear in terms of monitoring. The two at the bottom, the EEA is the European Environment Agency. Their platform is absolutely amazing. And it's amazing because of the way that their statutes and the EU developed them and promoted them, and then allows them to do their job really effectively. And I'll talk about this a little further on. And then the UN Environment Group is responsible for the GEO program, the Global Environment Outlook, which is basically how you assess the status and trends across the entire globe. So you go from everywhere down to the EnviroAtlas at EPA, which actually, and Air Now, which allows you to go into your community, your zip code, in some cases even your street, and look at the status and trends of a parameter there, all the way to a global outlook at the geoscale. So you span everything on all these different platforms. But again, there's not one that necessarily draws them together. So that's the statutory side of things. Let's think about a little bit about how strategic goals and mission come into play here. So EPA's mission is really simple. It's to protect human health and the environment. Our current strategic goals through 2022 are to provide a cleaner, healthier environment, have more effective partnerships, and provide greater certainty, compliance, and effectiveness. Within the plan, they specifically call out the need for reporting status and trends. EPA's strategic plan identifies the measurable environmental and human health outcomes the public can expect from EPA and describes how we intend to achieve them. The strategies to achieve EPA's goals and objectives are also informed by gathering evidence related to environmental problems and evaluating the effectiveness of the strategies that that program uses to address them. All parts of society, communities, individuals, businesses, and state, local, tribal governments have access to accurate information. And so within the strategic framework of the EPA are these mandates and these strong edicts to perform and report, to take data that's of sound quality and present it in a way that's defensible to a broad group of people. So that's the boring part. We kind of walked you through everything that just says, you know, how do we get to where we're going? How did we get here? What drives us? I think it's important to note that also that on a lot of these indicator platforms, you know, it's mission specific, it's goal specific. So it's what you or that group feels is their goal and their priority that they sets up what they collect and how they report. So how many people in the room, and I can't have people online raise their hand, but are familiar with indicators, use indicators? How many have actually gone through the development of indicators? How many have gone through development of indicators for something pretty heavy like the UN Strategic Development Goals? Right, once you get to that end, it's pretty lofty and it becomes quite a time-consuming and quite complex problem. And it does so for a few really good reasons. So real fast, does anybody have a good idea what a good indicator is? This is the kind of, you know, lecture teacher kind of 7 o'clock at night kind of thing.
Has to be clear, objective, measurable.
Clear, objective, measurable. Good. Yeah. Right. Does anybody know what a good, what is a good indicator for? What should a good indicator do? Indicate. Measure results.
Measure progress.
Measure progress. So before we get to that answer, I forgot to put a slide in here at the last minute. So what's a trend? I think it's always important to talk about status and trends if you have an indicator. So a trend is a changing condition, output, or process of an average or general tendency of a series of data points to move in a certain direction over time, represented by a line or a curve on a graph. Trends can be reported at different scales. If you get to a mega trend, you're talking it's a global scale. It can go all the way down to the micro scale, local communities, whatever. A trend may be strong, it may be weak, it may be increasing, it may be stable. Statistical determination of a trend does not necessarily mean it has any more value than a trend that doesn't have any statistics applied to it. A trend is a trend, a line is a line. There is no guarantee that a trend observed in the past will continue into the future. So the way we think about a good indicator for the report on the environment, and this is not the official EPA position, is a successful indicator in part is one that enables a discussion about the number and not where the number came from. It means that that number is useful, objective, transparent, reproducible, and defensible, and that the data underlying that are characterized by sound collection, management, quality assurance procedures. It's timely and describes changes or trends, and by timely we mean it's delivered over a period of time that's relevant to the types of decisions that you want to make or the type of information that you require. It's comparable across space and time. I'm not changing my method. It's representative of the target population. And so what do we mean by a successful indicator is one that enables a discussion about the number and not where the number came from. A good indicator, the classic example of this is the jobs report in the US. Every month that number comes out. 175,000 jobs added to the US workforce. 225,000 the next month, 150,000 the next month. And when that number comes out, what you hear is the spin. You hear, America's doing great, we're adding jobs, the economy's fantastic. What you never hear is, I don't believe in that number. I think the method, the calculation, the process, and the data that they use to collect that number is wrong. Therefore, I don't believe the number. Most everybody believes the number to the point where you have a discussion about jobs in the US. And it becomes a mechanism to inform a conversation. That's what a good, strong indicator or metric does. It stirs a conversation to impact change. And if you really want a fun discussion on this, there's a Planet Money podcast. It's number 821. It's called The Other Davos. And in this one, there was a group from Saudi Arabia put together an indicator effort like the ROE that had 700 indicators on it. They were data massive. They collected tons of information and they measured everything. And then when they talked to the decision makers, they were like, yeah, it's data. I don't really care. What I care about is whether or not, when I'm looking at that number, does it spur somebody to action? And they talk about the sustainable development goals and these really high endpoints of 2030, 2050 out there. And we're developing tier 1, tier 2, tier 3 indicators. Do we have the data? Do we need to get more data? Do you have to develop the methodology? Regardless of what you do, no one really cares about the trends. What they care about is that we're actually taking measurable actions to get to an endpoint. And that's what good indicators do. Not all of them do it, but that's what we strive for when we think about what makes a good indicator. So it's thinking beyond the trend, it's thinking beyond the data, it's thinking beyond the number and how that number is being used and what that number can be used for. To do this, it's important for organizations that build reporting platforms and that develop indicators or use indicators to clearly define what their purpose is. And so I told you we're going to see this 3 or 4 times. This is the second time. This is the EPA's purpose statements, our vision, mission, goals, and client statement. But our vision is important because that establishes the scope and scale that we will report. We do national importance. We don't do community level reporting. We don't do state level reporting community or state level reporting. We don't do global. Our audience is national in scale. We may break it down a little bit just for fun, but for the most part, we are only dealing at the national scale. So that sets up when someone says at the end of the day, hey, what's the error in my neighborhood? I'm like, go to the environmentalists. I'm saying, I know who to pawn them off to, but that's not what we do, and it's something that we will never do. The mission establishes why we do it, because we want to improve the environment by providing information that's defensible, independent, and up-to-date that people can use to have an informed conversation around. It establishes how we do this. We're going to be innovators in how we collect information. We're going to be innovators in the way that we report information. We're going to be innovators in the way that you see the information digitally displayed to you. We're going to be innovators in the way that we analyze that information. And so just having an indicator and collecting that data isn't important enough. It's continually thinking about how different people see information, use information, gather information, how you take all this other information and link it to other things. It's that continual innovation behind the idea. And the client establishes who we're talking to and how we're putting that information out there. It would be really difficult to say, my primary audience is the administrator of the EPA and the general public. 2 different audiences, 2 completely different goals, 2 completely different ways of using that information. So by setting one as the primary, that drives how we do it, and then we can feed that information down second-handed. So what makes for an effective indicator? This, I think, is the old school way of thinking, but it's true and it's still relevant today. To get to an indicator, it's just not a data point. You just can't sit there and say, oh, we need something X in order to measure Y. You know, we need this indicator. Everybody comes up with an indicator. So indicators are popping up every day. There's new information. Everybody's got an idea on how to measure it better, faster, quicker, etc. For us, what we really like to think about is if you're going to do that, think about it as a formal process. Walk your way through, you know, what it is, what's the decision that you need to make, right? How do you want to use this information? You know, what information do you need to do your job better? And then you work with it. Now that you have a clearly defined need, you can begin to think about what are the indicators, like how would you measure that? And so there are no arrows on here on this diagram, so don't think that you go magically from left to right, left to right, if you're sitting in the audience. This is just basically the different steps and the different ideas that you would need to consider to develop an indicator to make an informed decision. The two red boxes, the status and trends products and the assessment products, are how you visually and narratively give that information back over to a decision maker to say, here's the result of that status and trend. And these aren't as simple as sitting writing down saying the line goes down. These can be fairly complex documents involving a lot of different types of analyses. But the one thing that people don't really ever tend to think about are the data usage, the data storage, the data management, the data collection, the data coordination. Where is that information once you have it? Where are you going to put it? Who's going to be watching it? If I'm dependent upon, and this is not meant to be a knock on academics, but if I'm in academia and I'm collecting information, and I've been collecting this information for 15 years, let's say on bird populations in South Dakota, and I have this really beautiful trend data and I have this really beautiful stuff, what's the legacy when I retire? What's the guarantee that that information will be moving forward? You know, is there like a chain of custody in place that if someone's going to use that information for decision making, they can know it will be there when they need it. And so thinking about simple things like that when you're developing an indicator, it's just not data, it's just not a measure, it's everything around it that's really important, especially when you're going to tie it to decision making, and especially when you're going to tie it to performance measurement and outcomes. A lot of what happens in terms of, you can think also in terms of method development and method training and monitoring design. What's the best way? If I have no idea, I have no data whatsoever that stands up to this indicator that I proposed, and I've got to start from scratch. What's the best monitoring design that I could put on the table that's not only high quality data, that's repeatable and replicable, and has sound methodologies behind it, but is also affordable and economic? You know, so how do I get that information, right? And so you have to start there, and that has to be part of the process that you're thinking. The other thing that there's this beautiful program that the Office of Water and the Office of Research Development, EPA, developed. It's called the National Aquatic Resource Surveys. Came out of the need to monitor. We didn't have a really good measure on the nation's water quality. We just, under the Clean Water Act, there is no purview under the Clean Water Act to have states monitor their waters the same way, at the same frequency, at the same time, or even have to report it. And so you have this hodgepodge of some states do it really, really well. Other states kind of take a little, you know, attitude towards it, right? And so you have this hodgepodge. And so the National Aquatic Resource Surveys was developed about 15 years ago to monitor and assess the nation's waters, streams, lakes, coastal systems, and wetlands. And they started with the monitoring design, the method development. You know, what methods are we going to do? Then they have people that go out and train the people that are going to sample so that they know that they're collecting the data properly. Then you have the data coordination, the data collection, the data storage, and all that comes in. And so there's everything from the blue to get to a status and trends report for the nation's water. So it's a comprehensive view when you think about an indicator. It's just not one up and go. So I told you that's the old framework. There's a lot of good in that, but it's missing a lot of parts and a lot of pieces. And so in 2006, you were told, don't talk to strangers on the internet. Don't get into strangers' cars, and don't share your personal information or location on the web. 2019, you literally share your location on the internet so strangers can come and pick you up in the car. It's disruptive innovation. It's taking an old paradigm, shifting it, thinking about it in a new way, and breaking the norm. This is Uber, this is Lyft, right? Netflix did it, Zillow did it, Apple did it, Airbnb did it, right? And it's because you're thinking about things from a slightly different perspective. And so with indicator development, if you talk to any of the big programs, one of the things that we constantly are saying, or the way that we've been feeling over the last 3 or 4 years, is we're in a rut. And that rut necessarily isn't paying off. We need to be innovative. And how do we do that? I have no idea, because I'm not innovative. But the way that we need to think about the way we develop indicators, when you think about data collection, it's just not a sampling protocol. It's just not an EPA method. Can we use citizen science? You know, data storage is cloud technology. Can we use our artificial intelligence, machine learning, remote sensing techniques? The number of sensors we have in space, in the sky, and on the ground is mind-blowing, exploding every day. And so to be able to be on the ground now, thinking about those and how you would pull them into an indicator for decision-making to report status and trends is critical. Like this is an exciting time, I think, in indicator development and metric development more than any other time before, because we have all this new information and all this technology that's coming right here, right now, and we can either wait, sit by, and let it advance, or be a part of the train. You have personal sensors, you have data analytics techniques, how to comb through this data quickly, easily, and get out. The red ones, human-centered design, behavioral psychology, and neurosciences. Indicator development and presentation for decision-making is just what we do to get the information in your head is just as important as the information that's on the paper or the screen. Are you a verbal thinker? Are you a literal thinker? Are you a detail person, not a detail person? Are you a critical thinker? Are you a narrative thinker? All these different things really plays into how you take in and perceive information and how you use it. So a lot of what you see on our website currently is kind of old school, but we're working with human-centered design people, behavioral psychologists, neuroscientists to make that information more accessible to a multitude of people for different and variety of different reasons. So you need to be able, that makes for an effective indicator as well. It's not only the data, it's how you tell the story behind the data. So for the ROE indicators, what we'll talk about a little from the rest of the point going forward, we're doing for time, is that ROE indicators are numerical values derived from actual measurements of a pressure, state, or ambient condition, exposure on human health or ecological condition over a specific geographic domain whose changes over time draw attention to underlying trends in the condition of the environment and human health. I'm telling you, this is my lane. I'm going to work in this lane and this lane only. Our indicators are useful, objective, transparent, and reproducible. Our indicators are vetted through an internal and external scientific peer review. It gives us credibility. It moves us from, I don't believe where that number came from, to I believe the number. Let's talk about the change between them. They're vetted and they're validated. We don't put on our website for the report on the environment provisional data, and we don't put forecast data yet. Provisional data, what do I mean by that? I mean that for if you go out over the last year and people have collected information, and I want to come up with the annual average for NOx, nitrous oxide in the atmosphere for the annual, what's the annual national number? There's a lot of measurements that have to be taken to get all rounded up, and they have to be computed and put in this little package. All the data has to be QA QC'd. So we can put that information up as it comes in, but we haven't QA QC'd it, we haven't vetted it, we haven't validated the number. And so until the offset error says, we've gone through all our QA QC checks, now the number is non-provisional, it shows up on our site. So that's why when you look at our site, you'll see a lag of maybe 3 years. Like we'll say we have the most up-to-date information. It's 2014, but it's the most up-to-date, validated, vetted information. It's not provisional, right? Unfortunately, we can't work like the jobs folks and validate that number every month. That would be great, but we have too many partners. Our underlying data are characterized by sound collection and management and QA protocols. They're timely and describe changes and trends over time. We provide updates as fast as we can online. You don't have to wait for a 5-year report. This past year, we've updated close to 35 of the 80 indicators on the site. They're comparable across space and time. We don't change the methodologies. If the methods change, we have to send them what we call to the indicator retirement home. We send them off in a different direction, and we have to bring a new one up. And they're representative of the target population. So the report on the environment. Here's the 4th time, I think, 3rd, 4th. This is the last time you'll see it, I promise. The ROE program provides environmental policy decision makers and others with scientifically defensible, up-to-date, objective, and relevant indicator-based products that are of national importance for protecting human health and the environment. Our job is to report trends. We develop indicators, not really, and we inform EPA priorities and we communicate to the public. A brief history, it's been around for a long time. It goes back to 2001 under Administrator Witt. And it was designed as an initiative for the EPA administrator for the purposes of informing EPA priorities and assessing mission success. It was never meant to be an external facing thing other than to report how we're doing. It was meant to be an internal part about how we are doing. It's meant to create a really interesting conversation. In 2003, we released a draft as a published report, and I meant to bring the report with me and I didn't. In 2008, we released it as a published report, but we went electronic. In 2015, we went all digital. We don't produce a paper copy. We don't produce a 5-year annual report. Everything you see right now is on the web. We've now taken that design that was released in 2015. We've developed a long-term strategic plan, and we're now implementing that to move forward. I do think that one thing to be clear about here, to be in full disclosure, what's the problem? What's one of the problems with the statement of saying, for the purposes of informing EPA priorities and assessing mission success? When you set that up as your goal, two things can happen. One, you can have people who buy into it and say, yeah, I'm really interested in learning about EPA's mission. I want to help EPA succeed in its mission, and I'm going to use this indicator to do my job better, is what you're supposed to do. But typically what ends up happening is people, and people are people. And so what you get is, my trend's going down. I don't want my boss to see that, because then I'm not doing my job. So people have a tendency to see things like this as a check against their performance. And it really hampers what you can do with it when you have that type of mentality, like in your organization or throughout. And we've suffered through this, and today we still do a little bit, but we have a new guy on who's like, no, it's all about performance, not your performance, the agency's performance. We use it to make what we do better. So that's how you take negative criticism. So the report on the environment, we inform agency priorities and communications by reporting what is happening. That's our status and trends things. We do analytics, which is what is happening. That's the assessment component that's independent of the website, and I'll explain why in a moment. And we do prognostic, which is what might happen, but we don't put it on the website. The dynamic web-based platform describes the national and regional status and trends. We currently have about 80 indicators, and these indicators aren't ours. We don't collect the data. We don't manage the data. We beg, borrow, and steal the best information from all these other agencies and work with them collaboratively. We lead an environmental and human health community of practice, which is where we met Blair and Tanya, for One Health, which is bringing together the minds that develop all those EPA websites that I described. All the people who work on those come together. We talk about technical issues, we talk about marketing, we talk about indicators, we talk about all this stuff, but we bring, up until almost 2.5 years ago, the indicator developments in the agency were all dispersed. We never talked to each other. But now we have a forum in which we talk to each other every month. Last month, we saw the European Environment Agency came in and we did a host of conversations back and forth, so we've branched out to them. And this Thursday is the UN GO6 folks are coming. So you're establishing this community of people who do this so you can leverage artificial intelligence, you can leverage data gathering, you can leverage all that stuff and that brain power. Our structure is around 5 themes: air, water, land, human health, and ecological condition. Within each one of those themes, we ask a series of questions. Now, these questions were developed back in the early 2000s. They haven't been updated, and I'll show you what some of those questions look like. So we have questions around outdoor air, land use, human exposure. Here, disease conditions is one thing. When you look at a theme, here's the human health theme. What are the trends in human exposure to environmental contaminants is one of the questions. We have human exposure are the indicators below that, and we have blood cadmium, blood lead, blood mercury, serum cotton, for example. On the right is the disease and condition question. So what are the trends in human disease and conditions for which environmental contaminants may be a risk factor? So we have asthma, birth defects, and I'm going to point your attention to the blue infectious disease indicator down there, and we're going to talk about that in a second. So under this one, if you see something in bold green, it means it's trending in the desired direction. If you see something in red, it's trending in the non-desirable direction. If it's black, it means that there's no trend. There's no discernible trend. So you can see for human health, the indicators that we have, and generally, most things like blood lead levels are going down. General mortality is going up, or down, sorry. Infant mortality is going down. Life expectancy is going up, right? So you're living longer, we're dying less. So we're seeing these favorable trends. When you hit an indicator, this is just our one of the landing pages. This is for infectious disease associated with environmental exposure. This is the number of reported cases of arthropod-borne disease in the US. This one is specific to Lyme disease. What you see is an interactive graph that allows you to hover over it. We display the information through a series of exhibits different ways. We provide a basic data discussion. Where did that information come from? What's the data source behind it? We provide you a way to go and get the data. And so like if you click on an Excel file, all the data that was used to create this graph will be automatically downloaded onto your computer, so you have the data yourself. You can toggle between different types of things. The center tabs in the in-depth data discussion, the introduction with the data show limitations, those are tiles. You click on those and they expand out and they go into more detail about that. And then you can go down to where to go and get into the weeds, which is for more information. The report on the environment, the website is free of interpretation. We don't explain anything about why that trend is doing what it's doing. And we do that for a particular reason. And we do that so that you know, right? We're not biasing you with what we think the data are doing. The website is just meant to be the data to allow you to go in and interpret what the data is doing. We may do an assessment product, but that is something separate that's not tied to the website. The website is free of interpretation. It's just the data, or if you're an old Dragnet fan, it's just the facts. Here's a summary of what we have so far. So a lot of the indicators go in a lot of different directions. So we have 80 plus indicators, but this table sums to 108, and that's because in some cases indicator can be in multiple themes. So for air, water, land, human health, exposure, and ecological condition, for air we have 29 indicators. 20 of those indicators are showing improving condition, 6 declining, and 3 are in intermediate state. The 6 that are declining are generally associated with CO2 emissions, CO2 concentrations, temperature, and those type of things. So they tend to be more the climate change related stuff. The ones that are improving are all the national ambient air quality standards, so ozone, those type of things. Water, we have 3 improving, 2 declining, and 14 that are under a different state. Human health and exposure, 9 are improving, 3 are declining, 8 are the same. Those were those colored boxes I showed you earlier. So really quickly, we'll run through some general things about how you can use the ROE. So there's a lot of information on there, but the ROE is the only platform that combines information like this across multiple teams and across multiple sectors. It's meant to kind of begin to fill that void at the very beginning of not having a unified platform. And so here we have an indicator on energy use, which shows US GDP and total energy. That's the box on the upper left. So as energy use is flatlined, our GDP is going up. But at the same time, the ambient concentration of nitrogen dioxide is going down over time, and the nitrogen oxide emissions is also going down. So it's not meant to show causal relationships, but it's the type of stuff where you can say, I can pull data from here, I can pull data from here, I can display them together, and I can begin to piece together a likely story. This is waters. This is water. So this shows the nutrient loads coming out of the Mississippi River for nitrogen and phosphorus. You can see that the trends in the latter half really aren't, they're staying pretty constant. They're not going up or they're not going down. And then the bottom one is hypoxia. It's the degree of oxygen depletion in the Gulf of Mexico, which is typically related to dissolved organic matter, which is related to nutrient load and photosynthetic production. So you can begin to see that the loads coming in from the rivers aren't going down. Hypoxia in the Gulf of Mexico is not improving either. A success story is Lake Acidity, associated with reductions in acid deposition. We were able to reduce through different things, the sulfur dioxide concentrations of the atmosphere through different regulatory knobs. And as a result, the acidity in lakes and streams is declining in time as well. So conditions are improving. We do some things. We're starting getting into this idea of resource management. So here, the top figure shows the quantity of municipal solid waste generated and managed. You can see that they all are going up in the early up to about 1975, and then they all begin to plateau, which means we're getting better at managing our resources, even though we're making more money and there's more people, right? This is heart disease is the leading cause of death in the US. So you can look at general mortality, the heart disease indicator on the left, and then the cardiovascular disease prevalence and mortality on the right. All right, so 2 slides and then I'll open it up for questions, maybe 3. So what's the link between ROE and One Health? And so on the left is the framing of the theme, the way that the ROE is presently set up. The One Health captures, on the other side, is the zoonotic infections, comparative medicine, and translational. So it's this overarching of everything you have going on. And so presently in the ROE, we have enough indicators that could allow you to go into and look at these different parts and pieces at the US national scale. Clear on that? Right? Not talking global, not talking Africa, we're talking US national scale. there's an indicator that touches each one of these boxes. And so I'm going to look at human health for a second. So this is the trends in infectious disease associated with environmental exposures. And we report three main areas: the reported cases of gastrointestinal disease, reported cases of arthropod diseases, and reported cases of Legionella. The red shows for that particular case, for that disease, it's getting worse. Green is getting better. So you can see Lyme disease is 4 times higher now over the period of record that we've been measuring. We went from 10,000 cases to 40,000 cases. And I know this is a bizarre slide. It's my first attempt, and so you're my guinea pigs. So in the middle, the ROE serves as a jumping off point to explore potential relationships among key indicators. For example, in the upper left, the reported cases of arthropod-borne disease, you can see the trend is increasing. And this is from 1996 through 2015. So hypotheses, some, not all, for this may be land use changes, longer growing season, and increased human exposure. And so the two land use changes, the green one, timberland, in the middle top, and land use changes lower left, show that overall, timberland isn't necessarily changing all that much. So at the national scale, Lyme disease is going up, but timber's pretty much staying the same. So maybe that one's not going to work. But land use change has changed dramatically over that same period of time. So here's the encroachment of humans into the wilderness, potentially creating that exposure to Lyme and ticks that you hadn't had before. Not saying that's evidence for the hypothesis, but you might want to lean in that direction, right? It gives you someplace more to explore. The annual temperature anomaly, you can see that over the years, ticks are more prevalent because it's getting warmer. Yeah, it's getting warmer. And then population and developed land changes to look at increased human exposure, more people, more urban areas, more urban sprawl, more contact. And so here's one way that, like, the information in the ROE, a platform like the ROE, allows you to go, because each one of these data sets comes from somewhere else. Lyme disease is CDC, land use change is from the US Department of Agriculture. The population change is from the Census Bureau, and annual air temperature is NOAA. So the value of having one platform versus multiple. Now, what we will do is we will jump you to each one of those sites, right? So that you can go get more information, because they'll have a lot more information than we can provide. But you've got that jumping off. So in conclusion, the three things that kind of take away is that there's a myriad of platforms that report status and trends for a variety of purposes: decision and communication, as well as spatial and temporal scales. Know what you're looking at, know why you're looking at it, know its limitations, know its strengths. A strong indicator is one that's useful, objective, transparent, reproducible, defensible, and relevant to its stated purpose. Again, know what you're looking at, and where did it come from. And then the final EPA's report on the environment vision statement, the 4th or 5th time that I put that up. So you should know it by now. I don't. I give this talk. So with that, I'm happy to take questions and see where it goes.
Thank you so much for the wonderful talk. As a token of our appreciation, the One Health Academy would like to gift you a flag that has been flown over the Capitol.
Oh, sweet.
We give all to our speakers. So thank you so much for coming and
That's
sharing
cool.
all your information with us. We really appreciate it. And I'll open the floor up for 1 or 2 questions before we wrap up this evening. Anyone with some thoughts?
What are you most excited about kind of in the future, like how this can be expanded or how this can be used? What's something that you think is the most exciting thing that can come out of this?
The technology and the data data visualization and the technology behind being able to take massive amounts of data and then crunch them down into the analytics, and the ability to look at artificial intelligence and use artificial intelligence is just, it's a game changer. It's a absolute incredible game changer, both in terms of not only how you do it here, but how you do the assessments.
Hi, great presentation, and really appreciate it. And you pose a challenge. Let me pose a challenge to you. One of the problems for the One Health concept is, and I don't know the U.S. system as well, but it doesn't have an indicator that really stands out and we can run with. So I throw the ball into your superb expert court as to how to define and develop and have a One Health indicator that really reaches the audiences that you described as the EPA's target. My second point is that there is, under the One Health Commission, an effort to move forward on October 31st with support for a bill that is in Congress called the Advancing Emergency Preparedness Through One Health Act of 2019. What I noticed about it, and the need for everybody who's here and willing to do so to sort of jump on that board and go forward with this, is that the two targets mentioned are HHS and USDA. And as you look at the three-legged chair of One Health, shouldn't EPA be one of the other targets for that bill? And my last point is, that flag might be a great gift for your son.
My kid's birthday is Sunday. That's the little kid in the orange shirt running around. All very interesting. I'd have to think about the first one in terms of the challenge that you put on. I have to go down and maybe dig into it a little bit and give you some thoughts. The second question, which centered on should EPA be involved, depends upon what level of engagement and what you need. In terms of like the Office Air is really engaged with UN and GEO. So we do a lot of stuff with air quality monitoring, helping them interpret data, helping them build platforms, helping them provide data for the US. So I guess it would be, the question is like, where do you see EPA coming in? And that's your job.
I think we will to give you some more context. It was going to make, thank you for the segue, but I was going to give everyone a bit more context. So the Advancing Emergency Preparedness Through One Health Act of 2019 was introduced in the U.S. House of Representatives and Senate, and this legislation would require USDA and HHS, which of course is not including EPA there, in coordinating with other specified agencies and departments to develop, publish, submit to Congress a national One Health framework for coordinating federal agencies under a One Health program. So there's been an ask out to both invite members of Congress to the Alfred exhibit and to ask local organizations if they're interested in being a part of the U.S. One Health Coalition that will be working with a main purpose to educate Congress. So that was my announcement for you guys after the questions, to just touch base on the fact that, you know, we are the One Health Academy and we focus on education. And so if anyone's interested, I'm definitely putting our name down, kind of hoping everyone's supporting me on that. But if anyone wants to get directly involved with Dick and I, kind of working with the One Health Commission and the students of One Health and the other groups that are working to formulate efforts to educate Congress, please let me know. But I don't know if that helps you answer your question a bit, Scott.
No, but I can jump on it because now I can answer the first question.
Yes.
So the first question is, if you're only developing a framework that's eventually maybe will be turned into a statute or something like that, or something that's going to the UN, be sure in that framework to clearly identify all that stuff I talked about what makes a good indicator. Don't do what happened in the Clean Water Act and leave it up to the states to decide how they want to monitor, because then you can't use the data. Under the Clean Air Act, they developed CastNet, so everybody had to report it the same way. Everybody has to collect it and at the same frequency. And so that is an amazing data set that one can use to look at individual on the ground, what's happening in my community, and then I can scale it up to the national level, and then I can send it to GEO for the global outlook. So when you're thinking about the indicators and you're thinking about what they're going to put in the language of the text, make it explicit that they have good data reporting and that you outline what you mean by that.
Great. That's perfect. Ending of our night tonight, you guys. So thank you so much for coming, for your engagement, and Dr. Hagerthey for all your information. It's been lovely. We will be here next month with Dr. Thompson. So thank you so much for coming, and please join us next time. And yeah, if anyone's interested in talking more about this effort, please come up to me after we close. And have a great night, everyone. Thanks so much.
Thank you.
Oh yeah, happy. How do you like it? Oh my gosh, of course.